If you see the history of gynae, it is actually evolved with the role of the woman in the society. Woman is the unit from where the entire health starts. You educate a woman, you educate a family. Absolutely. I think almost every woman is aware of at least two tools of investigations. One is the pap smear and one is the mammogram, who have family histories of cancers. So we could be actually looking like a BRCA gene. We could be looking at investigation that aims to detect that early on. For example, some patients have blood clotting disorders. So the blood supply to the baby stops in between. So baby doesn't get blood flow and there is a loss of pregnancy. Pregnancy itself is a huge stress. Even if it's the smoothest of all pregnancies, it is a stress on the body. The baby is going to take every possible nutrition it can from the mother. The risk of having large babies, which is called macrosomic babies, went up by 43%. So herein when a lot of people say that I will not take thyroid medicine because I will get addicted to it. How will you get addicted to it? And if you're pregnant, the risk of having a baby with neural tube defects. Social media is really buzzing right now that I had a baby and I'm back. You cannot just be back. The body takes 6 weeks to recover. How can you just be back? Things suspicious like a pelvic pain or there's discharge, secretions from the breast, or there's any change in the appearance of the breasts, or any such thing. You're detecting a lump somewhere. You should approach your gynae as quickly as possible. Literally, a woman's hormones affect everything from the top of her hair to right down to the nails of her toes. So it does have a huge impact. Blood pressure and diabetes in pregnancy is never taken lightly. Such patients are always kept in monitoring, and the monitoring does not end with labor and delivery.
Hi everyone, welcome to Talking Through. My name is Rahul, and today in this special podcast, we are trying to cover a very important topic, that is women's health. And we have in the show Dr. Swati Attam with us. She is a distinguished professional in this field with over 17 years of experience in gynecology. So without any further ado, let's meet our today's guest, Dr. Swati Attam. Dr. Swati, thank you so much for accepting our request and taking time out for this podcast. I really appreciate it. Welcome to the show.
Thank you, Rahul. Thank you for having me over. It's my pleasure to be here today.
That's great. And Dr. Swati, my first question is related to your field of specialization. I know it's really fast paced, and at times you guys have to work in very fast paced and panic environment. How do you keep yourself motivated, and how do you keep up yourself in such an very challenging environment day to day?
So, Rahul, the first thing I think is that if you love the work that you do, you never feel like you're working a day of your life. So, gynae is very close to my heart. It helps me to be a part of the solution of somebody's life. And that is a big motivation in itself. In fact, that was the reason why I became a doctor itself. And on the other hand, I think your own de stressing is also very important. So I'm a fitness enthusiast. I like to run, cycle. I'm an avid hiker, traveler, and that helps me to kind of refresh myself and bring my best to the work.
That's great. That's great. And I like to know, is there any story behind why you have chosen this field of specialization? I know you must have many other options post your MBBS. So
Yeah.
any personal inclination or any story you like to share?
My love for gynae stems from the fact that I actually love surgery. Surgery was my first love. During my MBBS years, I discovered that this is the branch which interests me the most. And while I went through my gynae rotation, I realized that it's not just one person that you're treating. Gynae encompasses the entire family. It's right from an unborn baby. It starts with embryology, from where there's just an ovum, and then it progresses on to a fetus developing, then into a baby being born, and its progression through life. If it's a girl baby, you can understand, still our future gynae patient. And then a woman through her various stages of life. Being a woman myself, I found it very easy to identify with the kind of trials and tribulations that we women face, not only physically as we transform through the ages, but also as our illnesses are very kind of specific to how women perceive and understand them.
Right.
So I just found it much easier to be adapting in this field. And that's what brought me to choose gynae.
Right. And as briefly you talked about the evolution. So I like to understand during your experience of more than 15 years, how you have seen gynecology as a profession or as a scientific field evolving during the course of time.
Yes, actually, this is very relevant. Why just in the last 15 years?
Mhm.
I feel that gynae has, if you see the history of gynae, it is actually evolved with the role of the woman in the society. As a woman's economic role has changed, her social connotations have changed, so has gynecology evolved with it. Like simple things like having control over your contraception, having control over what kind of sanitary pads which are available to you, or basic amenities in public spaces.
Right.
This all has evolved with time as women became more liberated, and probably the rise of feminism and
Right.
women being seen as women who are actually economically productive to the society. This has changed gynecology a lot. Result being that we have seen a good transformation, a very beneficial transformation in terms of diagnostic tools, in terms of techniques that are available to us surgically. For example, like laparoscopy, robotic surgery, these have come around now. They help us to have a quicker downtime after surgery. She is much more ready to go back to work sooner. The post operative phase is much more comfortable. Surgeries are a whole lot more scarless.
Correct.
So, all this has definitely changed as a woman's role in the society has changed. Gynae has kept up, and now it is actually keeping up good pace. It's quite heartening to see. Unfortunately, there is still a large segment of women who are not in the urban setup. And then we see Akshay Kumar's advertisements, where he's still requesting the masses
Correct.
to let's get women to the basic needs that they need. So, yes, but it's looking on a good path now.
Mhm. Right, right. And as you talked about woman empowerment, I like to know, basis on your personal experience, how the overall perspective of women changed with respect to understanding their own well-being in terms of awareness. How aware are women nowadays, and how open they are to share their any health-related issues with doctors?
So I will still feel that we have a long way to go. Women, unfortunately, are not the prime focus anywhere in terms of health. They are, though the government creates lots of policies, and we have a lot of conferences which advocate that woman is the unit from where the entire health starts. You educate a woman, you educate a family.
Absolutely.
So that is true, but in terms of actually translating into real life, there is a lot of gap. However, in the urban setup, we find women much more forthcoming. They are no longer shy to approach and put queries regarding whatever they feel is suspicious or they feel uncomfortable with their bodies. And economic independence has definitely played a role. Since they have their own paying power, they do like to come up to the doctors and ask their own
Correct.
questions. And fortunately, investigations have also become much more streamlined. So now instead of having long periods of wait and having results come in after many days, we are able to give quicker responses, quicker results, and that definitely
Right,
helps
right,
quicker
right.
treatment.
I also feel due to the technological advancement and various sort of diagnostics and screening techniques, I'm sure life of medicos like you are much easier in terms of giving the right guidance and medications to the patients. So
It's
it's
true. In fact, now I think almost every woman is aware of at least two tools of investigations. One is the pap smear and one is the
right.
mammogram. So it is very heartening to see. I remember in my undergraduate days and postgraduate days, it was so difficult to convince people to get a pap smear and a mammogram done. Now patients are so forthcoming, they actually come and request to you on their own.
Correct.
They actually, so pap smears is for any woman who's sexually active or anytime starting after the age of 21 right until 65, depending on whatever the condition is. You can do it every 2 to 3 years. And mammograms likewise start after the age of 40 right until 75, every second year or third year, depending on how high risk a patient that lady is. So now I have a great deal of patients who actually come and put in their own requests. And in fact, now with the LBC, HPV DNA, the cervical cancer vaccine being highlighted all over now in the social
Correct.
media as well as by our film celebrities, it's actually very nice to see that people are now understanding that this is something you can do in terms of prevention, and you can get a LBC HPV DNA test done. It's similar to a PAPS test. So you can get that done, and if it's negative, you can protect yourself for the rest of your life.
Correct.
So this is a very heartening move, yes. Investigations have definitely helped us to streamline.
Correct. Correct. And
Prevention is better than cure.
Absolutely, absolutely. And I was reading some article wherein it's mentioned that that HPV virus that can lead to various type of like cancers and other things. So, any view or any sort of cases you have seen in your practice?
Yes. So cervical cancer is actually one of the most common cancers of women in our country. Um, Thanks to the vaccination and thanks to the pap smear and lots of camps being held, there is a greater interest and it has made people much more aware of what's going on. So now schools also have a program. See, actually, children between the ages of 9 to 16 are the ideal candidates for immunization because that time your immunity is just developing and it has the strongest response to the vaccine. It works for life. And post 16, obviously, the dosage increases. It's two doses between 9 and 16, and then three doses after the age of 16. So definitely, this whole opening up this information to the public, and it has helped us to screen cases faster. I see a higher pickup rate now whenever there's an abnormality. We don't actually need to see it in such an advanced case any longer. Screening tests are helping us there, and definitely, but more importantly, with cervical this HPV virus, it's not as much as the cancer I have seen in my personal work as the STDs.
Really?
So that is the bit which has not been yet talked about a lot because warts that it causes and those are quite infective and they can actually cause a lot of psychosexual damage, though they are treatable and everything such, but they have a lot of other connotations on the health of the person. So I think that is something which I'm seeing more and more frequently in my work nowadays. And I definitely feel that needs to be highlighted so that people are quicker to take steps to prevent it.
And any other thing you like to suggest in terms of like screening or any sort of tests need to be performed by women of all ages, including adolescents?
Yeah, so actually, the panorama of tests that we could have in gynae and obs is very vast. Like, there could be a person who has recurrent miscarriages. The kind of investigation profile for her would be very specific to her and it would be quite vast. And then there are patients like who have family histories of cancers, especially if there's breast related or ovarian cancers. So we could be actually looking like a BRCA gene. We could be looking at a investigation that aims to detect that early on. So there's a whole gamut. But definitely, yes, I think women should be very conscious and aware of how their bodies work and what is not normal for them. And as soon as they feel that there is something suspicious, like a pelvic pain, or there's discharge, or there's abnormal appearance of, secretions from the breast, or there's any change in the appearance of the breasts, or any such thing, you're detecting a lump somewhere, you should approach your gynae as quickly as possible rather than leaving it to fate and
Absolutely.
postponing it that there are other important things to be taken care of first.
That's
I
right.
think a quicker approach will be a great deal beneficial in cutting down costs of investigation and treatment.
100% agree.
Definitely.
Right, right. And nowadays there is a lot of talk about any sort of diseases related to lifestyle. How do you see gynecological disorders that are leading to that are because of any sort of lifestyle, which is like food habits or
Yeah.
anything which is not correct?
True. So, just like lifestyle has created a whole kind of situation in the other medical branches as well, like we are seeing cardiovascular diseases and hypertension and obesity and diabetes on the rise. Likewise, gynae has also been equally affected by lifestyle. There is easier access. See, there has been a change in the attitude of the person itself, of the ladies itself. Like now there's access to overnutrition causes a lot of issues itself. PCOS, endometriosis, infertility. These are a whole. There's a gamut of things that comes with this, like gestational diabetes. All these things are known to happen because of it. Likewise, there is an increased usage of recreational drugs, alcohol, nicotine, caffeine. This has its own set of problems. Stress itself is a huge factor. In fact, you would be surprised that a large cases of what we call AUB or abnormal uterine bleeding, which is unexplained bleeding, uh, largely the biggest cause for that is stress. things like weather change, examinations, event in the house, all these are also triggers which will lead to dysfunctional uterine bleeding. So it is quite surprising that though we think that this has nothing to do with gynecology or obstetrics per se, but there's a huge impact of our lifestyle, of our health, of our eating and socioeconomic habits on the outcome of a woman's life.
And what is the role of hormonal balance in all
All of
all
this.
of this? Yeah.
So see, like just let's like chase it from one end. Like
Mhm.
even if you talk about stress, that itself is a huge trigger for causing hormonal
Right.
imbalances. And we can say two things which almost everybody has heard about nowadays is one is PCOS
Mhm.
and one is PMS,
Mhm.
premenstrual syndrome.
Right.
Both of them are two most common things that we are seeing as a result of the hormonal disturbances. And the most common factor for both of these is stress. So you can just understand, like, you can imagine the impact of how tiny triggers can change hormones. Obviously, your health in terms of nutrition, your if you're sedentary, if you are in the perimenopausal age group, all these factors. And the effect of hormones on a woman's life is huge. So, from having chronic pains to cardiovascular damage, kidney health, liver health, all these are also affected with hormones. So it's not just that your reproduction in terms of infertility or irregular cycles or having endometriosis or fibroids. This is not the only expression of hormones in the
Correct.
body. Literally, a woman's hormones affect everything from the top of her hair to right down to the nails of her toes.
Mhm.
So it does have a huge impact.
And it's leading to my next question. I know you are a certified cosmetologist as well. And while I was reviewing your profile, I was really interested to ask you this question. Uh, Most of the gynecologists, they are more concerned, and they have done their research studies, especially about the core topic, and that is perfectly fine. I don't have anything against it, but the way you think is really different in terms of getting to know what is affecting their mental well-being, right? As a doctor, apart from treating a patient by virtue of any medication or any test, uh, I believe this is a duty of our medical personnel, that they should always think of mental well-being.
Yeah.
And especially after the pregnancy period, once
Yeah.
we deliver a baby, several changes in body occurs along with
Yes.
hormonal changes. Some women they have hair fall issues, skin acne, and several other things. So the way you are counseling, treating your patient, and you have done
Yeah.
advanced certification in cosmetology, that is really fascinating,
So
and I like to know more about
yeah,
the
so it
idea behind
actually
that.
stemmed from my interest in cosmetology, stemmed from my love for gynecology. So, women, when they come to you, see, it's not like you are just treating an organ or a part of the body. A woman is a composite person. So, when, for example, like you just said, postpartum, post having a baby, your hair is falling, you have stretch marks, you have put on a lot of weight, and there is a very poor self image. Almost every woman goes through it. And at that time, if we refer her along, we send her to a dermatologist or to a nutritionist in isolation. I felt it was not really helping because I was seeing the chunk of the problem, and these people were treating one small bit and the other bit, and we all were seeming to be very disconnected from each other and not viewing the patient as a person. She's not just a patient. Actually, a post pregnancy woman is a woman. She's not a patient per se.
Right.
So, just stemmed from there that why can I not just put things together and offer solutions under one roof? At least whatever stopgap solution is possible. Maybe more advanced solutions will still be needed and she may need to head elsewhere. But same ways like when I have very young adolescent girls who are like 14, 15, 16, and they come in and there are obvious cases of PCOS. And I find that they have got excessive facial hair or body hair, and that is completely destroying their self image. And they're lacking confidence and they're bursting out in pimples. So it's just small little things that you can do which, give them comfort and also puts them on the track that this is a problem that has a
Correct.
solution. And also knowing that it has a hormonal basis, Because I am a trained gynecologist, I can actually look at that aspect of it first,
Correct.
and then just do what is absolutely basically necessary. And it is very heartening to see when your patients come back happier, more cheerful, more radiant. It's a, what shall I say, it's a reward in itself.
Correct.
That is beautiful.
No
And
doubt.
it definitely, I think if you look pleasant and you look smart, you definitely, your mental health also becomes much improved.
Agreed.
Yeah.
Agreed. So as we talked about like postpartum problems, issues, let's talk about stress-related disorders or any hormonal changes which you have seen during your practice in pregnant women's, and what kind of like eating habits or anything which they can do to just uh, don't like stressed out,
Yeah.
don't feel stressed out.
So, if you're talking with respect to pregnant women, pregnancy itself is a huge stress. Even if it's the smoothest of all pregnancies, it is a stress on the body.
Right.
The baby is going to take every possible nutrition it can from the mother. It, it's a very unpleasant line, but it actually says that the fetus is a parasite. So it is not concerned about the mother's health. It will take whatever it needs. But for a woman who has to support too, not only the growing baby but also her own nutritional needs, so stress from right from days when you have excessive nausea to being undernutrition, then to overcompensating by eating excessive unhealthy food because it is just very, it just changes the taste of your mouth, like chocolates and spices and all. So all of this can already like build up to a place where it is going towards a very unhealthy direction. And unfortunately, even if you're not a full blown case of stress eating disorder or something as such, just giving into your cravings all the time and not having the right kind of nutritional approach can lead to overnutrition, can lead to overweight mothers. Overweight itself is a reason for people to develop gestational diabetes, which is diabetes during pregnancy, and gestational hypertension, which is blood pressure during pregnancy. All these are interconnected. In fact, there was a study in Norway which said that if you like they considered a cohort of women who were on the who were overnutritioned, not even obese, but they were overnutritioned. The risk of having large babies, which is called macrosomic babies, went up by 43%. Now, macrosomic baby itself is a complication of pregnancy. A, the delivery itself is difficult, and two, the postnatal period soon after the baby is born, it can be very stormy for the baby. So, definitely, if you look at stress and then you look at the build-up of how a pregnancy can be messed up, it is very easy. Things like recurrent pregnancy losses, also, a lot of cases are very unexplained, though we have a whole battery of investigations. But often, more often than not, nothing comes in them. And then we actually have to help them to, look at alternative sciences, meditation, to calm them down. Obviously, we do support allopathically, and that is the most efficient approach as of now. But all these also need to be done to counter the stress of pregnancy. And pregnancy itself doesn't end with just simply delivering a baby. The postnatal period itself is also a huge part of, it's a part of pregnancy only. I think it doesn't end there. Until 6 weeks postpartum, the body is still changing, it's still adapting. So there is no avoiding stress in pregnancy, it's only how best you can manage it and how you can allay the adverse outcomes.
And things like high BP or high sugar during the pregnancy period, all these are temporary things. Are they subside
So
post
we are very
pregnancy or?
vigilant
Okay.
because blood pressure in pregnancy and sugar in pregnancy, what we call diabetes in pregnancy, they can have a whole lot of adverse outcomes both for the mother and the child. Like, for example, a high blood pressure can actually end up, if it just gets worsened, it can lead to a condition in which the mother can have fits, she can bleed internally, and we may lose her, and the baby may have to be born preterm. So there is a whole lot of complications. So stress and blood pressure and diabetes in pregnancy is never taken lightly. Such patients are always kept in monitoring, and the monitoring does not end with labor and delivery. These both conditions have a risk of recurring later life again. So these patients are always warned that your postpartum also you will be under vigilance, and then post the age of 40, they are at a higher risk of developing hypertension and diabetes as compared to women who did not have this during their pregnancy. So it is something which is to be always addressed for the rest of your life.
Correct, correct. And in my family and in and around, I have seen that thyroid is very common problem, and anyone, we don't take it very seriously. Not only in women, but if this occurs in men's as well,
Yeah.
nobody's taking it really, really seriously. But I know, because I have read some of the articles while I was preparing for getting a podcast with you. So I know it can lead to some serious conditions, starting with like weight loss to weight gain and many other complications.
Yes.
So what's your view on that, and how serious it can be if
So
not
thyroid
treated
is
properly?
one of the most vital organs of our body. Literally, the thyroid hormone has an effect on almost every organ of your body. So it's not something that you can just ignore and say if you have thyroid, let's just like let it hope that it'll pass on its own. No, it won't. The thyroid hormone, when it increases, what you see as an increased TSH in the reports is basically a cry of the thyroid gland that I am trying hard to produce, but I'm not able to match the production that is needed by the body. So, thyroid medicine is one of the best medicines in that sense. It has hardly any side effect. It mimics the body's hormone itself. And the doses are always adjusted in the sense that only as much as deficient is what we give. So, herein, when a lot of people say that I will not take thyroid medicine because I will get addicted to it, how will you get addicted to it? Your body is asking for that little deficit to be made up. What we are giving you is only that much. If you don't give, then every organ of your body is going to suffer. For example, specifically in women, the first symptom of thyroid dysfunction is basically your periods go irregular. They become scanty, they become spaced out. So, this is the first thing. It'll lead to infertility, it'll lead to hair loss, it'll lead to weight gain. Weight loss happens when there is hypothyroidism. But usually, what we commonly see is hypothyroidism, where it is insufficient production. So, all this, and then your pregnancy is at risk. In fact, thyroid hormone is essential for the development of the baby's nervous system. If your thyroid hormone is not in synchronization, then, and if you're pregnant, the risk of having a baby with neural tube defects, brain malfunction, spine deformities, this is much higher. So it is very important. It cannot be overstressed that one must have a normal thyroid function.
Correct.
And unfortunately, the cases are on rise right now. I think a part of it is to do with the environment and the pollution
Can
levels
this
which have
lead to
gone up.
like cerebral palsy, these sort of things in
Not directly
not directly?
though, but if there is a neural tube defect which leads to a condition which leads to brain dysfunction, then obviously one can have something like that.
Right, right, right. And have you seen any like a new trend in recent years apart from the traditional uh, diseases or any sort of alignment? Uh, is there any new thing coming up because of the lifestyle or
Yes.
food habits in your practice?
So again, the most common what we see, this one is, let's start from the younger age group only. One is extreme pain during periods, dysmenorrhea.
Okay.
Every other child I see now in the adolescent age group is having extreme dysmenorrhea. Then with that comes this polycystic ovarian syndrome, excessive facial hair,
Right.
and irregular periods. And then comes your this premenstrual syndrome, cases of PMS. The dysphoria was not so bad in the earlier decades. It is progressively worsened. And especially with sedentary lifestyle and too much exposure to social media, a different kind of expectation is there from themselves. I think that completely offsets their psychological health, and that leads to a lot of PMS is not just physical symptoms, it's also a lot of mental symptoms. And same ways in postpartum women, I see that this whole idea that you should just bounce back, there's a lot of trend. Social media is really buzzing right now that I had a baby and I'm back. You cannot just be back. The body takes 6 weeks to recover. How can you just be back? And the whole trend of, don't, if you haven't breastfed your baby, you're a bad mother. If you had a cesarean section, you are undervalued as a mother. this is all very strange now. This is all a result of this lifestyle and expectations, food, nutrition, movement. This is one part. Social media pressure is another part. So all this is also part of lifestyle, and unfortunately we see it. And likewise in menopause we are seeing. But a flip side of it, there is one good thing that has come of it. People report with symptoms earlier than before.
Yes.
Yeah, before they would sit and wait out. So now anybody who has the slightest mood swing in the perimenopausal period, she will come and say, I am having perimenopausal symptoms or something. It may just be a thyroid dysfunction actually, or it could be actually another depression. But the fact that she came, so you were able to diagnose something and help
Correct.
her along the right path. So
Just because
flip
so much
side
of
is this is good.
just because so much of information
Yes,
is
excessive
available.
information is serving us in some way.
That's right. And I've seen, especially in my family, sisters and mothers, they are doing self medication a lot.
Oh,
So,
that is another level of problem that we people are facing. So Google is a good doctor, but it
right.
leads only to one diagnosis for everyone. And definitely there is a lot of influence going on in terms of gummies, pills, powders, take proteins, take this vitamin, take that. It's not like so. Everybody has their own lifestyle. Everybody has their own genetic makeup. Everybody has their own nutritional needs. So I think the best thing, if you are actually suffering from any symptoms, or if you really feel that there is a need to start a supplementation program of any sort, visit a doctor, take a consult,
Correct.
know what works with you, get information, and then use that judiciously. It's not necessary that you need to visit us for every small little thing again and again, but definitely, being an informed person, you can take better decisions, and you can modulate your lifestyle and your nutrition and your supplementation yourself also, which is perfectly fine.
And in the second phase of life of a woman, when the menopause comes in and there is a change in the overall hormonal cycle, how do you counsel your patients to prepare for this particular phase? How they can keep them physically and mentally fit? And what kind of lifestyle changes do you suggest?
Yeah. So menopause is the third stage of life.
Okay.
From childhood and adolescence, and then we transition to the young woman, childbearing years, and then we say this is menopause. So as our life expectancy is increasing, the number of women who are hitting this has also increased. Menopause is very individual again. Some people have no symptoms and they transition so smoothly, and some people come in with a whole gamut of experiences which are very unpleasant and can actually hamper your everyday life. Forget about your work life, your everyday life can become very miserable. So obviously, the most common symptoms are night sweats, hot flashes, and all these vasomotor symptoms, dryness of skin, mood swings. So I think a whole lot of people are actually educated about this. There can be also a very huge spectrum of very strange symptoms like changes in the smell, like tingling in limbs, having a crawling sensation, being forgetful, walking into a room and just not remembering why you came in there. So when a person comes to you with any of these or some of these symptoms, you have to let them know that this is a part, this will happen, how to prepare yourself, you will have to. So you cannot live the same life that you were living before, neither nutritionally nor physically. You have to make changes for that. Supplements, सबको पता ही है आजकल, you need calcium, vitamin D, B12, magnesium. Improve your protein intake so that your muscles remain in good condition. Do flexibility training so that your joints are in a good condition. Arthritis and all sets in at this time. So you are just going to counsel them regarding that what are the small changes and shifts you can do so that your daily life remains smooth. And then you also have to tell them that if any of the other symptoms appear, then depending on the severity. Now, everybody does not need treatment. So there is a whole thing of hormone replacement therapy, which is made the circuit. It was very fashionable, and then it became an outcast, and now it's being explored again. So it's still in that circle that we are still going through with it. Hormone replacement therapy is not for everyone. It has to be very specific. The ideal candidates are those who are between 40 to 50. But there also we need to, have a complete input on the patient profile. What are the things that we want to tackle? So for that, and now we also fortunately have started developing new drugs that are helping in treating specific symptoms like jinko hot flashes aate vasomotor symptoms, what is called. So now there is a drug for that which can be used as and when it is needed. For anxiety, for panic attacks, for that we have SSRIs, selective serotonin receptor inhibitors. We have it's got a conjoint use in psychiatry as well, but it is quite beneficial here as well. And there is something called cognitive behavioral therapy. So patients who are still at the, at the better end of the spectrum where they are like not needing medical therapy in terms of medication, but are in need of some kind of modification of how to address the symptoms. So CBT is also an option now. So this is like what we call a cafeteria approach. Depending on what your problem is, there is a whole lot of options. But definitely, doing strength training and looking after your nutrition, these are the two most important things. And the third, and actually the most important thing, is looking after your mental health. I think we already at that part of our life when we hit menopause that now we could not care less. Let go of the stress, let go of the anxieties, and just enjoy the beautiful journey that we have now.
Absolutely, absolutely. And nowadays, there has been like multiple cases of like premature babies, miscarriages, infertility. How do you see why these cases are increased day by day? We have talked about the lifestyle change and other. Is there any environmental change, or is the way uh, like a we whatever we eat that affects our body, or
Yeah.
it's a genetical thing only?
So, preterm birth or recurrent pregnancy loss, they have a lot of medical causes as well. Not everything is because of lifestyle. There are a lot of genetic factors, there are a lot of physical issues which could be with the patient, which could lead to all of such. So, all of it cannot be blamed on the environment and stress only. So, depending on the cause, there would be a specific treatment. For example, some patients have blood clotting disorders, which makes the blood much thicker. It just clots the arteries. So, the blood supply to the baby stops in between. So, baby doesn't get blood flow, and there is a loss of pregnancy. In those cases, we use blood thinners. So, depending on the case to case, this is very specific. But yes, infertility is something which is on the upswing right now. Also, I think a big factor could be the increased maternal age at first conception. So, the definitions also for gynecologists have changed over the years. What was called elderly primary, which meant like when is your first pregnancy? So now it is 30 and beyond. So that has also shifted. As you grow older, the ovum, its quality has also become a little poorer. The risk of having genetic malformations and that leading to pregnancy loss is usually the most common factor. So that's why we have these techniques like egg freezing nowadays.
Correct.
And in IVF, we select healthy ovums and not degenerating ovums so that the chances of having a healthy outcome is much better.
And any advice from your end for any young professional, if they are planning to come to this particular field of obs and gynae, what kind of mindset they should have, and what expectation they can bring?
So I think if you come to gynae, come with a very selfless heart.
Okay.
Because there is nothing in this field, if you are, this field can never be monetarily remunerated in terms of the input that's given into it. Uh, obs and obs and gynae go hand in hand. So with obstetrics, you are 24/7 on call, 365 days a year. Sometimes you have to push back your family, your kids, and you have to take the call to do what is right. The call of duty is always higher. So it is quite stressful, and in fact, medical students are now themselves the subject of a lot of studies for this reason, that they have found, there was a study on gynecologists and in India, and they found that 29% of them had abnormal periods, 53% of them had sleeplessness and sleep disorders, and 38% of them were overweight, and some percentage of them were having anxiety disorders. So
Because of
this
the stress and work
the
pressure.
work environment is such, our expectations from it are such, this is not somewhere you can just leave the patient ever alone. It's like a lot of hand
Right.
holding. So yes, if you're committed to looking after and improving, or it's a passion close to your heart, there's an equal amount of passion in this, definitely you will enjoy this. It is the most fulfilling and satisfying experience ever. Every time you hold a baby in your hands, you burst. I still, like after having birthed thousands of babies, still, when I hold a baby in my hand, I never cease to be amazed. I'm like, wow, where did this appear from? This was not here now and it's here now. It's a new life, it's a new person. So, and when you see these children coming back to you as they grow older, it's a beautiful feeling. It
Yeah.
is absolutely delightful to see youth, innocence blooming in front of you. So,
Correct.
yes,
Correct.
it is very rewarding in its own way, but it does take a toll.
And before we wrap up, just to summarize
Yeah.
today's discussion, any advice for our audience among all three age groups you have mentioned, how they can take care of themselves and live a healthier life?
So, I think there is not one message that fits all, because every age has its own specific mindset and problems also. But yes, for women in general, I think one, we should be very aware of our own health, and that it is important. It's as important as any other family member's health. And a healthy woman is truly the base of a healthy home. Whether you're a homemaker or you're a working professional or you're a single person, which or whatever age you are at, you have impact. You are a person. There is a role that you have to play. If you are healthy, psychologically, mentally, physically, you are going to be way more productive. You will be way more happy. You will actually bring good things to people around you, not only for yourself. You'll be able to contribute much more positively to society in general. So, yes, listen to your body. Do not ignore. Women are very perceptive. They know very quickly when something is off. They will absolutely, like, I don't think any mother is not ever able to pick up her child's illness. Even from the
Correct.
cry, she will know that this baby is having this problem,
Right.
right? But when it comes to their own selves, they will just ignore themselves to the absolute end. When it's absolutely necessary, will they come to us? And I think if we just take care of a problem in its initial stages, we save a lot of grief, and we can actually cut down the time required for recovery and a healthier, happier home
Right,
much
right,
quicker.
right. And at last, if you like to burst any myths in and around with respect to like women health or any sort of medication, screening technology, anything which is a myth, but it's really prevalent and people are just falling up for it.
Yes. So there's only one thing which is my pet peeve nowadays, which is like this overdiagnosis of PCOS. Um, Unfortunately, see, it's a spectrum. It is a condition. It is not just a single investigation based diagnosis or a single symptom based diagnosis. And multitude of factors contribute to this. Why it is becoming overdiagnosed nowadays. Everybody self-diagnoses, or they just pick up a random report and Google it, or the wordings of a report are such that make you believe that you have this. So this is my pet peeve right now, that for all young women who have PCOS or have been diagnosed as PCOS or have self diagnosed as PCOS rather, please go visit a doctor, take a proper consult, figure it out that do you actually have it if it has. And then again, 90% of the treatment of PCOS officially is only lifestyle modification. So to expect some medicine will do drugs, make some miraculous effect on you, or it will not recur again. If you slip back in your poor lifestyle, obviously it'll happen again. So you just need to take care of your own well-being, and first of all, get a proper diagnosis.
That's the most important
Yeah,
thing.
just don't self-diagnose yourself to the other end and beat yourself up over it that now this is, and it's not a disease. That condition, it used to be called PCOD before.
Mhm.
That's obsolete now. It's no longer called a disease. It's called a syndrome for the same reason. But we just like to believe that the worst has happened to us. So I have PCOD. No, you don't.
Right, right.
It's all rectifiable.
Absolutely. Dr. Swati, thank you so much again. It was really an intriguing and knowledge enhancing session. I also learned many new things. And I know today, since this was our first podcast and we have limited time, so we have touched upon various aspects of women health and other technological advancement and various other things. But definitely, we like to invite you for another round of discussion wherein basis on your guidance, we like to cover some topic like a deep dive on a very specific topic. And till then, I just like to say thanks from the Talking Through team, and thank you so much for sharing your knowledge with our audience.
Thank you so much. The pleasure's been all mine.
Likewise, thank you so much.
Okay.